let me introduce to you the next session is going to be on capacity building and keys to action at the global level. I can see that we've lost a few people at lunchtime, but I'm sure the conversations are going on upstairs and they will return. Now, Dr. Harris Eyre, Brain Capital Alliance, OECD, Neuroscience-inspired Policy Institute, the Baker Institute for Public Policy, and the Meadows Mental Health Policy Institute. And the talk is entitled Brain Capital, Moving Beyond the Burden. And the thing I liked most about your CV is that you have been awarded America's EB1A Green Card, an honor typically reserved for Nobel and Pulitzer Prize winners. So you are in that elite, esteemed society. Well, we're very grateful to have you with us. Harris, the floor is yours.
All right, it's great to be with you all. This is extremely energizing, this collective of people, and the energy is quite incredible of the different dialogues and conversations that are happening. Today, I want to get to the point. I want to talk about the value of economics in the field to help us move forward. And I want to also talk about optimistic and hopeful narratives in the future, moving beyond the burden. So those are the two things, economics, and let's have some hope and try to do some things at scale. My basic argument is that we have many brain challenges. We've talked about many of the ones on the left already this morning and early this afternoon. And on the right, we have non-clinical brain challenges, but these are certainly significant. Mis and disinformation, nanoplastics, which are leaching into the water supply. They've been found now in women's breast milk and associated with knocking off IQ points of children. So very concerning. Social media, we know about in the news, is particularly negative towards youth, teenage youth, female mental health. So we have some serious issues that I wanted to frame up for you, and the ones on the right are the ones that are most novel that I wanted to talk about. But let's move beyond the burden, because it can be draining and overwhelming. Down the bottom here, I highlighted the things that we want to move away from. We have, to date, poorly applied prevention approaches. We've had a deficit focus, lack of personalization, disciplinary siloing, sector siloing as well. It's either public or private sector, not a lot of stuff in between. There's been political neglect. So this is kind of the state of where we are, right? So what am I proposing as a transformative strategy? I'm proposing to talk about brain capital, use it as just an instrument to provoke you all to think differently. You may not like this framing necessarily, but at least it will stimulate some perhaps better ideas. You can tell me I'm wrong and how you can make it better. We want to talk about prevention, global scale research, strengths, personalization. I know, Veronique, you're big into personalization and have some big things doing here. Transdisciplinarity, and then aligning these brain health issues to current societal imperatives, which Mike and I talked about earlier today. So brain capital is a new economic policy framework. Maybe you could think about it as like brain health is relevant to an individual, and I'm trying to say that brain capital is like a collective of a country's brain health at a big scale. So this is all about population level stuff, states or countries or pan-humanity. And brain capital includes brain health and brain skills. Wonderful that Lundbeck, Isabel, and colleagues produced a wonderful report that said that the world is increasingly relying on brain capital, where a premium is put on brain skills and brain health. That's an individual's cognitive, emotional, and social brain resources. And the WHO, Torun, I don't know if she's still here, but investing in, out of their report on brain health, investing in building brain capital is fundamental to meet modern societal challenges and to drive innovation. Brain capital is relevant across the lifespan. We all sit here on this spectrum somewhere. We all have friends and family on this spectrum. We all, support patients on this spectrum somewhere. We're all doing things good or not so good. One of the things I like about, I don't know where Fred is, but this conference venue was wonderful because the food outside is so healthy, so it's good for us, good for our microbiome. I recently published with, where's Orla? Yes, with EFNA, my personal story about how my migraines that I've suffered from since I was a teenager are actually a superpower. I can say that now because one of these new medications actually works for me. It's the first time a medication has actually worked for me with my migraines with Visual Aura. And as I reflected over the holiday period and thinking about how I'm not so much plagued by the migraines anymore, they're kind of been cool. They're the reason why I'm talking to you now. They're the reason why I went into medicine, neuroscience, and went into thinking about things at impact scale. So it gave me empathy and compassion. It's given me a purpose in life. I recognize that the drug that I'm on isn't available in any other country other than the US. So it also makes me realize how inequitable it is. If I was still living, in Australia, I couldn't get access to it, unfortunately. And I'm very grateful to my health insurance that it covers it, because it's otherwise very expensive. So it sort of makes me tuned into these inequity issues. Other health benefits. They say that people like me with migraines are very fastidious about our diet and health, because we don't really know what causes our migraines. And so actually that means that if I live a healthy life, I may be less likely to get heart disease and dementia as I get older. So that's a kind of a weird but interesting positive. I'm very creative. I have a lot of. I'm not very creative. That's not for me to say. But I do my best to have intentional creativity practices in my day, because I don't want to really work super hard, because it might trigger a migraine. So therefore, if I can have a creative insight, if I can go for an all walk in a forest and connect some dots, then that's helpful. And then obviously working in teams is critical, because I also don't want to get too many migraines, so working in teams is important to me. So there's just some interesting ways that I thought to frame up how brain disorder, I'm a neurological patient, I guess, but it can be positive. The Brain Capital Grand Strategy we published a couple of years ago now. It includes a dashboard looking at policy innovation and investing innovation. This is our Brain Capital dashboard, and I'm just wary of time, so I'm just going to get through these efficiently, and I can share links or my slides with anyone that's interested. The Brain Capital dashboard we've been developing over the last couple of years, which includes brain health and brain skill factors. This is country level data, country by country. How can we compare countries' brain capital against each other and over time? And the thing to mention is there are environmental drivers here of brain capital that we factor in. We have a beta version up on the internet. This is the URL. If anyone's interested, I can send it to you. It's great to see it take shape. And then some interesting policy advances that I wanted to talk about that are relevant to brain capital. There's a fascinating program out of Australia that's all about autism prevention, particularly using structured video feedback for autism prevention and more early detection of autism and remediation and rehabilitation. The reason why I present this is because they have 2 RCTs and an economic analysis study. So it's kind of interesting. If we could do this at scale, it could really help a lot of people to remediate their autism symptoms and help them to live a better and more healthy life. Interesting work coming out of Alberta here. How do we train people in sort of understanding brain story development over time, particularly to frontline healthcare workers and frontline emergency workers? They have, and school teachers, 50,000 people in Canada, in Alberta in particular, have done this brain story certification, which is all about how you build a brain, stress in the brain, all this kind of stuff. So it's a large-scale thing that's being done. HKS, an architecture firm, recently released a report on creating brain-healthy workplaces, which I thought was super interesting. It just came out a couple of weeks ago. Then they said that it's time to change the narrative and make sure that we leverage brain capital and improve brain capital in the workplace, because it's fundamentally good for a business, good for the business's revenue and productivity and all that stuff. These are the kind of things that they talked about, which you may or may not agree with. This is a result of a 12-month study, starting with start your day in the office with arriving and having breakfast with your team, make sure that you give people breaks throughout the day and cool places they can relax, give people opportunities to connect during the day, to do some joy, fun, game type stuff in the workplace. It's just kind of interesting when you think about the workplace and talk about how can we improve brain health. You get some interesting innovations. This is a wonderful paper from Nature Aging from an AARP executive, which is the American Association for Retired Persons. They talked about population level dementia prevention. So being social, engaging your brain, managing stress, exercise, sleep, eating right, produces all these benefits on the right to the economy. So again, linking brain health at scale to economics at scale is kind of a new vector that we can get more policymaker attention. We've had wonderful pickup of brain capital over the years from policy sector, private sector and media. And then on the investing side, there's actually been a venture capital fund mooted on the topic of brain capital technologies, mental health tech, neurology tech, ed tech, things like that. It's wonderful to see that they're paying attention. We've also seen Andy Keller may talk about this, my colleague from Texas who leads the Meadows Mental Health Policy Institute. We're working in Texas on a bill to get an extra $3 billion of neuroscience funding in the state of Texas. And there's an interesting equivalent from the cancer field that's determined that if the state government of Texas has funded cancer research, it's generated a 2.5 to 4x return on investment. So in Texas, it's meant more jobs, more outside investment into the state, intellectual property development, and tax revenue. So again, using economic narratives to convince policymakers to invest more in brain stuff. But Andy will talk more about it because Andy is much more intimately involved in it than I am. So next steps for us to get to the point here, we're thinking about, and I'd love people to come up and talk to me about it, developing a brain capital task force in the lead up to the Belgian presidency of the European Commission. Could we do something at scale to look at policy change in Europe heading into, the Belgian EC presidency? This would be interesting. Well, we need to talk about this later as well. We want to do a yearly monitor on the brain capital dashboard, so a sort of audit and account of the brain capital dashboard and discussion of it. I think that will be interesting. So look, comparing countries, US versus Germany, Australia versus New Zealand, things like this would be, who knows what kind of insights we'll get from comparing brain capital data between countries. We're actually thinking about developing a city-level brain healthy city dashboard. We'll be presenting at some conferences about that. And then we're also looking at and submitting to specific projects and grant opportunities to try to drive this forward, because brain capital is huge. It's across the lifespan. If we can target specific projects, in different age groups, different conditions, we can start to, again, make the point that brain capital is important. And then finally, we will have an innovation summit on brain capital. Christian, do you want to put your hand up, is hosting this in Silicon Valley in late June, where we'll be talking about technologies for brain capital at the intersection of healthcare and education technology, which is a fascinating nexus, thinking about how do we help people with learning disorders learn better? How do we help youth that are depressed to learn more? How do we help people in the workplace that are depressed to remediate their depression so they can be more engaged in their job? These types of narratives and technologies, there'll be investors there, economists, clinicians, teachers. It'll be a fascinating kind of multidisciplinary group. So thank you very much. I hope that, again, I made the point that economics is important and we want to try to leverage that discipline, and that we can think about a new horizon for ourselves with some hope and optimism. Thank you very much.